I'd like to open up the floor for questions for any of the speakers. So there's one, I think, which is has come through here, and it's more so on the future, I guess, of the wellbeing visions and the creation of it, rather than the past of what you did, but how the biggest challenge here is how we get meaningful and real visions without having physical meetings where people can build on each other's ideas. So I don't know if anyone has any insight to share into that, or is that something that's still being figured out?
I think you have to go with your last statement, that it's something that we're still trying to work on. It's a massive challenge, and any of the PPNs that are involved this evening who have either started or are waiting to start will know that this is a massive challenge, and a challenge for PPNs working in lots of ways. You know, we're all getting familiar with doing this type of engagement, but that's fine for the people who have access to equipment and access to internet and are happy to work on computers. But for a huge number of PPN groups, that's simply completely exclusive and isn't helpful. I think, you know, the idea of doing smaller local sessions, you know, is being suggested. The problem that I have is that if we miss the opportunity for people to have a bit of conversation around this, and the sort of sharing that Pozy and Tess have highlighted, we miss a huge part of what's important and valuable. And it's something that we haven't talked about, but in the process, there's an ability to essentially, because it's consensus based, there's an opportunity for you to veto it. So if I come along and I say something that somebody else in the group can't live with, and that'll go up when all the inputs are put online, then they're able to simply make a note to that effect, you know, to put across against it and say, I can't. Now we can get in a conversation about it, we can try and sort it, but essentially, if it's just a case of everybody flings up their wish list, we're going to find it very hard to build consensus. So I would be really interested to hear from PPNs what ways they have of having localized conversations, of getting their members' views and having some conversation. It's that piece that we're finding hard to fit in.
I know there's a few resource workers at the moment who've joined us. If any of you have been having any physical meetings or anything, your input into this would be great as well. Is Limerick PPN saying that the DRCG has written to all PPNs to say the statements don't have to be completed this year, so there is more of there's a longer time on it than only this year, so you'll be happy to know that. Any tips on communicating the vision to the local authorities? So what kind of experience have you had in getting the vision across to local authorities? And maybe Siobhan, you might have some insight into that.
Like I said, just make as many presentations as you can. I presented to the councillors, I presented to the regeneration team, the LCDC, the Healthy Longford Committee, like just really take it to everyone. And then when you start getting results and it's feeding into different strategies, keep promoting that as well.
And you were saying before as well, Siobhan, that I found really interesting was the councillors were actually really on board with and really interested in the vision as a completed piece, because they found it really interesting as to the insights of the community. Absolutely,
and I'll just give you one example because it might be easier for people to understand. As you know, like Centre Parks is in Longford. So when we did the visions, I guess we were expecting the Ballymahan Municipal District, where Centre Parks is, for the groups there to be all about tourism, but it actually wasn't. Interestingly, it was the Granard Municipal District that really wanted to develop the tourism trade and hospitality, and the Ballymahan Municipal District were more interested in developing community and digital hubs. So I know the councillors found that very interesting, and there's lots of different examples like that. But it was quite easy once you get your vision and you get your booklet done. Just as I say, tailor it to your audience. Make sure whoever you're presenting to is going to get something out of it. I think that's the key.
I think it's very new for councillors as well, because usually councillors come to the council meeting with just a problem in the area to be solved. But when Siobhan goes, she has a whole complete plan really for the well-being and development of the county, which is the difference. I don't know, does anybody hear me?
Mm-hmm. Yeah.
Did you hear me?
Yeah, we heard all that.
Yeah. No, I think that makes a big difference. That it's very unusual for a county council meeting to get a presentation that encompasses the well-being of the whole community. Normally, it's an individual thing from a councillor, or it might be a presentation from Irish Water's Ways or something, which is just only about water or something. So I think it was very well received by the council officials.
Okay, brilliant. And just to another point on that before we move on, the main initial interest we got from LA's, this is Sarah Weatherald, was the regard to it being a huge resource and valuable piece of research that would inform the development of upcoming LECPs. So that's another piece that LA's would be interested in it for. Limerick PPN is asking, Limerick is currently working on building its linkage group structure. How does the linkage group structure fit into the vision statement development, or the development of the vision happen through the linkage groups? So how are they involved in the process?
Essentially, they don't, in the fundamental process, and maybe this is important, when you look at the process or you're looking at rolling it out, it was designed so it can have all the bells and whistles you like on it. You know, you don't have to have just a consultation meeting in any municipal district, and we've talked about how difficult that is. So in some places there've been multiple meetings and smaller meetings or whatever, but it is for the member groups themselves to come out and start making their inputs. The linkage groups tend to be between people interested in a particular area or aspect of the work of a PPN, so that they can come together to develop their thinking and maybe make a stronger case and help build arguments and agree how they want something pursued, maybe at a particular committee. At least that's my understanding of how the linkage groups are intended to function. So they don't per se have a role in the development of the vision. They'd have a role in supporting it being pursued, if you like, the PPN's working to actually get it delivered. Does that make sense to other people who've done it? Yeah.
Okay. And another one coming in here, is there an overarching system of evaluating the local authority engaging with the PPN and their visions?
I don't think so.
Overarching system. So is that evaluating the engagement from the local authority? I'm afraid I don't quite, I can't quite get my head around that question.
Yeah, sorry, Catherine.
Yeah, go for it.
Yeah, that is it. Yes, evaluating the collaboration between the local authority and the PPN and our visions. Is that clarified? Okay.
Can I come back in there? There's no standardized way of doing that. There's no one measure for it, Sean, but I think the idea is that if you have the vision and then you've got a local authority that is refusing to listen or to take you up on what it is that the PPN is pushing for in a committee or whatever, then you have the measure is there. You know, we've this is what we're looking for. This is the basis that we're looking for it, which is our vision. We've made these various attempts to get it on the agenda, to ask for this and that and the next thing to be done, and we're not getting any constructive engagement, and to then use that as the basis for a pushback to require the local authority to give you some engagement. There isn't at the moment, at least unless somebody's got something wonderful up their sleeve, a standardized approach for evaluating the success of the engagement with local authorities.
Thank you.
Okay, any other questions? We have 5 minutes left for Q&A, so use the time and get as much knowledge as you can. Anything's itching you.
Can I come in there? Can I be
Yeah.
heard? Do you know what? I'm going to put on the speaker a second. I've been heard saying this previously, and I can't resist it when there's time to. I'm curious about the model that's been used is a UK model, and it was published after the National Framework for Improved Health and Wellbeing was launched. And I'm curious how there's no reference to Healthy Ireland in any of the discussions when we are talking about health and well-being in its broadest sense, with all the social determinants of health that are mentioned in the model. Was I heard? No?
Yeah.
Yes, you have been heard.
Can I suggest Michael might be in a position to answer that?
Sorry, this is Michael Ewing here, formerly the coordinator of the environmental pillar, and one of the people who sort of helped to found this whole process. It's got nothing to do with the UK at all. In fact, it was a totally Irish developed project. We've started back in the decision to establish the PPNs included a line in it. The PPNs would develop a vision for their well-being for this and future generations, but there was no actual substance of how that should be done. So the environmental pillar, along with Social Justice Ireland, spent 2 years meeting with a whole range of stakeholders about how we might go about doing this. And at the end of the day, we decided what we'd do is, with the department, we worked out we'd invite 4 PPNs to be pilots to work out a way of doing this. So with Harriet's great guidance, Longford, Wicklow, Roscommon and Cork City became the pilots. We spent 6 months meeting fairly regularly, working out a process. And the process that now exists came from that entirely. And the six domains, as it were, of well-being came from that process. They didn't come from outside at all. They came from inside. Obviously, we looked at lots of other processes. We looked at the Carnegie processes that have been developed. But this is the only one in the world that is bottom-up. There is another one in the planet like it, as far as we're aware of, that is bottom-up. Charles has suddenly appeared on the screen. I'm not quite sure why.
I'm here.
Did you want to
I was also involved in the start of all of this, and we did talk, spent a lot of time talking Carnegie, because they have done work in Wales and Scotland and so on. And we went looking for some money from them, but they wouldn't give us any, so we gave up talking to them and decided to do it ourselves, as Michael said. We did study very much the Australian model, Canadian model, the UK models, and so on, and found the problems with most of them, they're all top down. Whereas with a PPN, we have a unique possibility of doing this in a bottom-up fashion, which is what we've done, and which has been ended up where we are now, with a unique bottom-up wellbeing statement, which is, you know, very different from the way it's done in other countries.
And indeed, as a result, far more valuable, I think, because it is owned by the people. The process was created by the people who are going to deliver the vision, and it's now being owned by the people as they develop it. And if you talk to any of the resource workers and the secretariats and the members of the PPNs in the counties where it's been done, such as Wicklow and Longford particularly, they are just flying with it. It's extraordinary the way it's got developed, and they're so enthusiastic, and fair play to them. They've run with it, and obviously in the background you have this wonderful person called Harriet Emerson, who's kind of working with them at different levels over the years and helping them to deliver. But it really is a grassroots process, and it's fantastic.
Brilliant. That might be a good point to ask in Justin Byrne. He has a comment about how we might proceed with it. Justin, would you like to come in there?
Yeah, hi everyone. I'm sorry, I'm sort of sitting in the dark here, but first of all, I want to agree with Michael and Charles. Like the Irish process, having seen the Northern Ireland process and the Irish process work, the Irish one is so much better. And the people who have done it are just, it's almost like a cult once you've done the wellbeing statement. They're just such evangelists about it. South Dublin hasn't managed to get his act together to do it yet. And one of the things I noticed when I was helping with some other counties is that an awful lot of the people who attended the sessions knew each other. And I think that's probably the way we have to start working in a COVID friendly way, because if we can't have so many physical meetings and we have to have social distancing, if people know each other, at least that really helps the initial barriers to be broken down. And the other thing is that the county councillors are obviously chosen from throughout the county with the local areas, so there may be a good role for them to help in that they will know people in each area as well. And I still don't know how we bring it all together, but I think that's probably the starting point, is very small and very local, to get people talking. And you'd be amazed how many people in a county know people at the other side of the county or throughout the county. So it's all I can think of to start the process off.
Okay, thanks for that, Justin. Okay, so we're just on the time for the Q&A. If anyone has any other questions, please do put them into the chat, and we're going to get into a group discussion now, so there mightn't be time to answer them in the chat, but we'll try and get them answered afterwards as well. So please do type in any questions you have there.